Good morning, guys. Today our topic is going to be about malignant melanoma. What is melanoma? Melanoma, it is a very serious form of cancer and it is due to the cancer of melanocytes. These melanocytes are usually present in the stratum basal layer and produce melanin. Sometimes these melanocytes get clustered together and form non-cancerous growth called moles. These moles can either be flat or raised, round or oval, and are small in size. They are generally harmless, but they also can become cancerous. So, what is the etiology and the risk factors? Etiology and risk factors. It may be due to the family history of melanoma and any previous melanoma, when there is more than 50 moles in our body, and severe blistering sunburns, and it mostly occur in fair skinned people. So 90% of all melanomas are linked to UV radiation, 8% due to chromosomal abnormalities, and 2% is unknown. So next, the signs and symptoms. Melanoma can appear suddenly as a new mole, or it can develop slowly in or near an existing mole. In men, it occurs between the shoulder and hip region and head and neck area. In women, in lower legs as well as between shoulder and hip region. It may also appear under fingernails or toenails and in palms or soles. So, how do we diagnose this melanoma? So, we have a criteria called as ABCDE criteria of melanoma. So, A stands for asymmetry, B stands for border, C stands for color, D stands for diameter, and E stands for evolving nature. So, asymmetry. When one of the mole or birthmark does not match the other, then it may be considered as melanoma. And border. When the edges are irregular, raised, notched, or blurred, it may be considered as melanoma. C. The color is not same all over and may include shades of brown or black, or sometimes with patches of pink, red, white, or blue. And diameter. When the spot is larger than 6 mm, it may be considered as malignant melanoma. But malignant melanoma need not be always be larger than 6 mm. And evolving. E stands for evolving. When the mole is changing in size, shape, or color, it may be considered as malignant melanoma. So, this is the ABCDE criteria for malignant melanoma. So, let's see the types. We have 5 types, that is superficial spreading melanoma, nodular melanoma, mucosal melanoma, lentigo maligna melanoma, acral lentiginous melanoma. This superficial spreading melanoma is the most common melanoma. They occur in the superficial region and spread outwards. And nodular melanoma, they are usually nodules of pinkish or bluish black in color. And lentigo malignant melanoma, they usually occur in old age people and people exposed to sun radiations. And then acral lentiginous melanoma, they occur in palms and soles and toes of the feet. And mucosal melanoma, they are not very common and it is a very serious form of melanoma and it occurs in mucosal regions. So, how do we stage this melanoma? We have 3 staging levels. They are Breslow thickness, Clark level, and TNM staging. Breslow thickness, it measures the depth of the melanoma from top of the granular layer to deepest point of invasion, a critical prognostic indicator. Clark level, it describes the anatomical level of invasion. TNM staging, it takes into account tumor thickness, regional lymph node involvement, and distant metastasis. So, treatment of malignant melanoma. First, the primary treatment can be like surgery. If melanoma has spread to nearby lymph node, these lymph nodes may also be removed. So, next one will be the SLN biopsy. SLN stands for sentinel lymph node. It is a procedure in which sentinel lymph node is identified, removed, and examined to determine whether cancer cells are present. It is procedure to see if cancer cells are spread. And next will be immunotherapy, then targeted therapy, radiation therapy, and chemotherapy. Next, the prognosis. Early detection. Early detection leads to better outcomes. Thin melanomas have high cure rates. Prognosis worsens with increasing thickness, ulceration, and metastasis. And follow-up, early melanomas. For early melanomas, every 6 months for 2 years, then annually. And advanced melanomas, every 3 to 4 months for 3 to 4 years, and then every 6 months for 1 year later. So, conclusion, this malignant melanoma is a serious condition with potential for rapid progression and metastasis. Early diagnosis and treatment are crucial for improving outcomes. Thank you.